of scleroderma. So with Raynaud's, what exactly happens is that during the cold weather, the normal response for the blood vessels is to get small, and the idea of getting small is to conserve heat. In scleroderma and other connective tissue diseases, the response is exaggerated, such that now it closes more narrower than normal. And by doing that, the color changes and becomes white. Then from there, it becomes now purple, and then now pink. And it's often associated with pain. So the triggers are, apart from cold weather, is stress. Other symptoms in the crest symbol is, if you talk about calcinosis, talk about Raynaud's, is esophageal dysmotility. So they have problems swallowing food, and those have acidity. The next one is sclerodactyl, which basically means this tightening of the skin around the fingers. And then crest, the last one is T, telangiectasia. So telangiectasia, what it is, we have the blood vessels around the cheek and a part of the body become wider. Those are one of the signs. So those are for limited scleroderma. So the difference between limited and systemic is that limited primarily is in the lower or the outer aspect and the face. Diffuse or the diffuse one now has more general overlap the body, because you have organ involvement. The most common organs involved include things like the kidney, lungs, and the tummy. Yes. And so in terms of the symptoms, maybe you can jump to your question about the symptoms. In the lung, can present with cough, which is a dry cough. Can also present with dyspnea. So dyspnea means basically shortness of breath. Yes. So the other thing we can present in the tummy. Tummy, apart from acidity and problem swallowing, is that when this collagen gets deposited in the intestines, it means the motility of the intestines is reduced. So you have a lot of bacteria. So some patients can present with diarrhea or bloating. In the kidney, you can present with kidney damage and high blood pressure. Apart from that, can also go to the brain, can go to the heart.
We will get back to this discussion and understand more about scleroderma, but first, let's listen in to Phoebe's story.
I was born a normal child. I grew up a very playful child. And when I was in class 8, I started having having Raynaud's. Later on, I came to know it is Raynaud's. When it was cold in the morning, the hands were turning bluish. And a lot of itchiness on my skin. I couldn't sleep at night actually. So I went to a local hospital. The doctor thought that, this is not a very common condition. So the doctor thought it is a Omo or detergent. I thought also it is the one that was reacting to me, but it wasn't the one. So I stayed. I never sought further medical attention. Then I think I went to high school. After high school, now in Form 3, the fingertips now started becoming very sensitive, and then they started having, we call them masses. I hear the doctors call them masses. So I went to the same local hospital. They told me, I think you need to seek, further medical attention. I was thinking it's a skin problem all along. This was in, I think, 03. Yeah, so I came and I went to a dermatologist. So he told me, they did all the tests. Then I was told that I have scleroderma. Yeah, then I started the journey. I thought it was something that has a cure. Even when the doc, even when the doc told me that you need to be on drugs, I ignored and said, I'll just pray it out. And by the way, I think the first years it worked. I didn't use drugs. I wasn't using drugs for about 10 years. I ignored drugs. I went through, high school, went through campus without drugs. Started working without drugs. Then, when I started working, you see, waking up very early in the morning and you don't even understand your health. I had nobody to walk with me this journey of understanding what really scleroderma can do to you. So my first job, let me just share this. My experience with the employers was not very good. After campus, I think I stayed for more than 5 years without a job, or rather without a... And anytime people are hiring, I think I faced rejection, maybe because I look. There are things that, even actually when I'm walking, I find people giving me a lot of stares. And I don't know. But anyway, I think I came into terms with it, and whenever you stare, it doesn't really affect me. At least you've seen something that is not normal according to you. But this is my normal. At least I thank God, because, you have to go through somewhere to get where you are.
So we've talked over the signs and symptoms, but now I'd like us to also talk of now the physical features. I'm sure the signs and symptoms are in the early stages of diagnosis. So what are the now physical features, some of the features that you can identify?
Okay, so I think the most obvious thing, if you go by the term, is hardening of the skin. I'd request if you could help me with your hand, please. So when you have scleroderma, you are unable to pinch. Ideally, when you pinch, you should be able to lift part of the skin. In scleroderma, I'll not be able to pinch. Okay, usually here and here, and this is now widespread throughout the body. At the same time, when you turn to this side, you might get dilated blood vessels here, and then sometimes they get ulcers on the fingertips. Okay. Apart from that, you can get, because the skin is what is the major thing. Early in the disease, you can get a lot of itching, and so they have a lot of itching marks and everything. Another sign, when it's early, you get like a puffy or a swollen finger. Apart from that, the other symptoms involved, if you look at the face looks like a mask. So you find the face is very tight and the mouth is very narrow or small. They're unable to fully open the mouth. If you are to inspect inside the mouth, because they are not able to fully open, they will have a lot of dental issues, dental caries and the rest. Apart from that, looking outward, that's what we can see. Internally, we'll probably have to do further tests depending on what the patient has. So take, for example, like in the lungs, we usually do a CT scan or a CAT scan. We're able to see elements of scarring that is there. If you were to do for the tummy, you can see the scarring on the intestines. Yeah.
And maybe about the physical features of the hands. How do you differentiate between now rheumatoid, because I'm sure for rheumatoid there are similar features, and scleroderma?
That is very true, and usually those are some of the challenges we have. One major challenge we have with this particular group of diseases, we call them autoimmune diseases, that a disease can start like rheumatoid, but after years of following up, eventually find out it's what? It's scleroderma. But simple things that can help guide you in terms of which is which is that usually for rheumatoid arthritis, maybe I can use maybe your hand, sorry. I can use your hand. Rheumatoid arthritis primarily affects here, here, and here. Okay, and when it comes there, it swells. Okay, and in the morning there's a lot of stiffness. Okay, for scleroderma is a bit different. Scleroderma will probably get some ulcers here, but also if it's very advanced, the skin is more tight, and you get like a claw deformity. And that is more prominent for scleroderma. But like I said, sometimes we've had cases in the past where, like I know a patient who we had been following up for rheumatoid, and then later on they found out it's what? Scleroderma, because the problem with autoimmune is a lot of overlap. And you can have one you can have two diseases, yes.
So you will say scleroderma, there might also be misdiagnosis of the disease.
Yes, there might be misdiagnosis. But once you see the typical hardening of the skin, it's very, very unique, because about 95% of the patients will have that particular disease.
So it's not similar for different patients. It's the signs and symptoms might be different, other than the tightening of the skin.
Yes.
Like, for example, if you my mouth, I am not able to close my mouth. Actually, when I'm walking, when I'm walking, some people forget and you, madam, close your mouth. Yeah, shut your mouth, or something like that. But other than that, I think the skin is tight, the fingers are bent, loss of hair also. I do wigs a lot. Yeah, I think even my teeth. I think there's something I've seen with scleroderma. I don't know. Yeah.
Just to take you back, does it come later on, or does it develop with age, or is someone born with it?
So, like limited is mainly in the younger group. But in terms of the demography of who gets more of the scleroderma, from research has shown it's between the ages of 30 to about 50. And usually this is the time when people are the most productive in their life. They're maybe starting a family, or they've gotten a job. So those are the main people who get it. Afterwards, it's very rare, but that's mainly the main area that when people start getting the disease. And usually this is a challenge because now your life changes completely. Yeah.
Okay. So we can touch on treatment. Is it a curable disease, or it's just about management?
So curing is a bit difficult, to be honest, because we still haven't found out why the disease there. I'll usually give the example of malaria. Malaria, is caused by the malaria parasite. So to treat it, we give the drug that targets the malaria parasite. But for scleroderma, it's a very complex disease because there are a number of factors that come in. We have said there's one, the role of the autoimmune process. Two, we have the collagen, meaning the excess tissue. Then three, I didn't mention it earlier, it can also cause issues with your blood vessel. So your blood circulation is reduced. So in terms of how to target becomes a bit of a challenge. But generally what we do is we divide the drugs into categories. So we have the immunosuppressants. The immunosuppressants now work on the immunity side now to try and suppress the inflammation. So we have drugs like methotrexate, we have drugs like mycophenolate that have been found to be beneficial, even azathioprine, and sometimes we give them steroids, sometimes. Apart from that, we also have to deal with the symptomatic part. Like for Raynaud's, sometimes you are forced to give them blood pressure medicines, because the blood pressure medicines keep the blood vessel open and patent, so you have no symptoms of the blood pressure of the Raynaud's. We also have acidity problems. We give them drugs for the acidity. If they have bloating, because of the excessive bacteria that is in the tummy, we give them antibiotics. So we basically just immunosuppressants and then the symptomatic management.
So you just talked of the immune system.
Yes.
What's the broader impact of scleroderma on someone's health, and how does it affect other body parts?
So because it's autoimmune, it means that it can go anywhere, in short. So the most common complication for scleroderma is the lung. Even research, I think, locally has confirmed that. And usually when it goes to the lung, it makes the lung, it scars the lung, or it burns the lung. So on scarring the lung, it means the patient will present with cough, difficulty in breathing, and because the lung is what gives you the energy to move around, you have a lot of fatigue. Apart from that, the same scarring can go to the esophagus. So from the esophagus, you have the acidity problems, you have problems with swallowing the food. Apart from that, it can go to the heart. When it goes to the heart, you have rhythm disturbances, because the rhythm means the heart is supposed to go beat a certain way. So when you have scleroderma, the beating process is interfered with. Apart from that, it can also cause with Raynaud's, we've seen a few cases where it's unfortunate because of the Raynaud's can be reversible and irreversible. Irreversible means the blood vessels completely do what? Shut. When they shut, it means the fingers die, so you have to go and cut or amputate. We've seen a few cases like that, which is very unfortunate, and most of the cases will come maybe the time they thought about scleroderma was when the patient developed the what? We call it gangrene, or the fingers die off. So in terms of the impact, it has a lot of impact, because the example I use for my patient is that you are okay today and tomorrow everything changes. Take for example, and most of them are ladies. So you find a lady now, ladies have a lot of, in terms of appearance, is very, very important. Now you're looking hard skin, you're wondering now how will people think about me. If it's a young person, will I get somebody to marry? Work also becomes a problem, because with scleroderma, the days you're fatigued, the days you're admitted, the days you are home. So those are some of the things that happen. Apart from that also, it impacts also in terms of activity, because your lungs are not 100%, you're always tired. So we encourage your patients to do what? Exercise. One other thing which we tend to forget as physicians is that there's the part for the sexual component, because a lot of these patients have either impotence or erectile dysfunction. If it's for the ladies, because the skin is dry, even the private parts, there's no lubrication. So it becomes a challenge for some of these patients. Sometimes they are too shy to speak out and say that I have this particular problem. So the impact is there. The impact is there.
Mm-hmm. So with all that impact, how does someone living with scleroderma manage their condition?
So the thing about living with it is the first thing is acceptance. Because sometimes we diagnose patients and they think that, no, this guy is just saying his own things. Sometimes they seek opinion from a second doctor, or sometimes and worse, they go to a witch doctor. And acceptance is good, because we set targets when the patient comes. Because the model we use is, or which I use, maybe I can talk about myself, is a partnership. And a partnership means that I'm able to tell the patient what are the expectations. Because some patients come when the disease is very advanced. The problem with an advanced disease is that in terms of to get back to the beginning becomes a challenge. Because once the fibrosis from the collagen deposition sets in, and you've been having it for a couple of years, reversing it becomes a bit of a challenge. And sometimes patients take long to accept that particular reality. So you have to educate them and tell them that it's going like this, and the drugs don't treat, they control the disease, and then you should get better. In terms of living, I think it also helps have a good support system, family, friends, and so that people are aware about it. Another of living with which is that I think creating awareness, like this particular forum is good, because we have a lot of patients who are suffering, and at least awareness is important, because I think like getting jobs becomes a challenge. If you want a social life, also becomes a challenge. So these are some of the things that they need to accept. In terms of diet is something which you forget, because the mouth is smaller and they have a lot of acidity problems. So we usually advise our patients to eat small meals. I mean, instead of using 3 meals, you can be up to 5 to 6 small meals, and that helps reduce acidity. At the same time, we discourage eating oily food, sodas, things that can maybe aggravate the acidity. When it gets cold, like during the time for our winter, which is June, July period, it's good to stay warm. It's good to stay warm. Another thing that can also help is exercise. The more you exercise, the more your lungs open up and your blood vessels open up, and it helps. Smoking is also bad, because smoking worsens the Raynaud's. Smoking also worsens the scleroderma. So we try and tell our patients to avoid as much as possible from smoking. Mm-hmm. And usually it's an ongoing thing, talking to the patient, yes.
Mm-hmm. I wanted to assume that I'm normal, and other people are not seeing that, so I had to, accept I'm not. Something is not normal. And actually, I decided now to to register with the Persons with Disability National Council. I think after that, I think it has been very easy, because you don't need to explain to people. You don't need to explain to employers why you look like this. Why are you looking weak? I don't. There are those people that will always make you feel a lesser being. Maybe because you're sick, they think, but I think you need to surround yourself with people who believe in you and who sees scleroderma or any other chronic condition as just any other disease, and who considers you a fighter, for that matter, not a sickling. There's a difference. I just don't want to know what it does to people, and I will go on with life.
Okay, so now maybe we can go to a call to action, because from Phoebes Story, there's a lot of stigma that is associated with this condition. Phoebe says that at some point someone in the streets will tell her to close her mouth because of how it's been affected by this condition. Maybe just your word to people to create awareness.
So to create awareness, I think this is a beautiful platform. Scleroderma is not contagious. I think that's the first thing we should talk about. Secondly, scleroderma does not mean if I have, I will give my children. That's another thing. Thirdly, with scleroderma, I think is just to accept. There are so many people with all sorts of chronic diseases, and I think the earlier we accept people for who they are, the better for them, because these patients go through a lot. Like for the ladies, in terms of the beauty care and everything becomes a challenge. Working is also a problem, and then also forget that if you get very advanced disease, your hands are deformed. So getting a work for a computer becomes a problem. Simple chores at home become a problem. Even some of them we have to advise about shoes, because what goes on up here also goes down there in the shoes. So those are some of the things that they go through about. So I think these patients go through a lot, and it's not a contagious disease. So I think the earlier we accept patients for who they are and encourage them, and I hope one day, because like where I studied, they get a lot of there's a disability fund they get. So I think going forward will be something worthwhile from the government to consider, like supporting our patients, because some of the drugs are very expensive. They are very, very expensive. The tests are very expensive. They're supposed to be working. They cannot work. So if they can be able to get like some rebate or some monthly supplement, it will go a long way in improving the quality of life of these patients. And I think for people just to accept, it is very sad when I say to some patients here and they're telling me like their social life is dead, because everybody thinks it's a witchcraft and all that. So I think accepting is the first step. Yeah.
Well, shukran sana for your time, and thank you for educating our audience. All right. So just like any other autoimmune disease, the journey with scleroderma is not easy. To the warriors, try and stay positive, for just like any other person, you can lead a normal life. Like we've heard from Daktari, the disease is not contagious. So to the society, let's embrace these warriors and stop stigmatizing. That is all we had for you from Health Nuggets. For any questions and comments, you can always reach us on our social media handles as displayed down below on your screen. Stay safe. Until next time, your health matters.